It is such an honor to be here today, to be with all of you today. And I want to share with you part of my journey to this stage, my journey to finding who I am, what I'm supposed to do with my life, and how I want to make a difference. And so I'm going to start from the beginning of who brought me to this dance, to this stage. And everything I do starts with family. So here you see pictures of my family, from my great grandmothers in rural South Carolina. I have family roots in Georgia and Mississippi, to the picture of here with me, with images of me, with my grandmother, my mother, and my daughter, to now this next generation with my 4 grandchildren. And it's this family that set the stage. It's this family that gave me my foundation about my values. I was raised in a family that was about God, family, and purpose. And for me to think about what I do, how I use the gifts I have been given, how I live my life in a way that I can make a difference and improve the lives of others. Part of my purpose, but do it in a way where I know who I am. I know from whence I came. That I expect respect and I give respect and I respect myself and my journey. That at all times I do my best. It doesn't mean I'm always going to be on top or always get A's, but I need to know for myself that I did my best. That I'm going to make mistakes, lots of mistakes, but I'm going to own them, and I'm going to learn from them, and I'm going to grow from what I've learned. But I don't own other people's mistakes. They can't give them to me. They have to own their own. And at all times, I am enough. I don't need to be more than. I am enough. And then I go to high school. You see me with my hair. Okay. You see me in high school. And I'm in high school. My father was in the military. It's a military family, and he was stationed there at a Nike site. And I go to a school where I'm, for most of my schooling, the only black student. And it's time to go off to college. And I go to the guidance counselor, and the guidance counselor says, you know, where you want to go, people from our town, people like you, don't really go there. You should not apply. But I told you about the family where I grew up. I told you about the ladies, grandmothers, mothers, aunts, the ladies who instilled in me that anything I wanted to do, I could do. And I would not advise this for anyone else, but I only applied to one college. The one they told me not to apply to. The one I went to. Okay? All right? And then it's time to think about what do I do in that college. I go to Brown. And there I discovered this space where I could learn new things. I could try. I knew I wanted to be a doctor, but all of a sudden, do I switch and become get a doctorate and a PhD, or do I stay with medicine? And this journey of understanding who I am, this journey of understanding that I love to be with people, and I needed to be with people, and I needed to be with community. So I chose Mount Sinai School of Medicine as I left college. But in that space of college, I started to understand what it meant to have a community of people with shared vision, shared outlook on life, and what you could do together. And that's when I joined a sorority. Never thought I would join a sorority. I come from a family where my mother and my grandmother had never gone to college. My mother actually graduated from college the year I graduated from medical school. But there you see me, more than 40 years later, with sorors that I was in college with, still work with and communicate with. So what did I learn from this high school and college? Others do not have a right to define my boundaries and my dreams. They are my dreams. That I belong wherever I want to be. And to do things together with others is always better. So then I'm at Mount Sinai Medical School, chosen because they have a wonderful community program, and get involved in those community programs. Those community programs where I started volunteering and then spent time at Harlem Hospital with Dr. Gunning in pediatric rehabilitation, and while there, did work with the visiting nurses and started to understand the lives that people lived and the ways in which what happened in that medical practice and in that office did not determine the health of patients and families by itself. If you don't have access to food, and if you don't have access to shelter, and if you don't have good education, and you can't feel safe, you can't be healthy. And I also learned in this space, it's not the doctor that does everything. It's how we come together as a community, how others share in this space of trying to create and bring health. I learned about the work of visiting nurses. But I also spent time in South Carolina visiting my family in the Out Islands. I'm Geechee, I'm Goa, in South Carolina at the Buford Jaspers Health Clinic. And there I had this privilege of going around with my cousin, who was a social worker, to homes and families, and seeing, in many ways, part of what I'd seen in New York City with Mount Sinai, that you don't have to leave this country to see poverty. It's all around us if we open our eyes. And we see the ways in which people survive, persevere, hold on to land, and struggle. And I saw this in the faces and the lives of the people I had the privilege of meeting in South Carolina. I go from Mount Sinai, and as I'm leaving, I'm starting to understand, I knew my family history. I knew this history of people who'd been enslaved and persevered. I didn't know about the people in medicine who'd come first, and this is about Rebecca Lee Crumpler. I was born in Boston. She was a physician. She was the first Black female physician. You know, oftentimes people talk about us as though we've just arrived. She got her degree in 1864 from what is now Boston University. Her degree actually called her a doctress, not even a doctor, a doctress. That headstone that you see was placed during COVID. These are our firsts and how we treat them or don't treat them sometimes. Members of the community found the unmarked gravestone of the first female Black doctor in our country and came together and forced the medical schools to come together to put a headstone to commemorate Dr. Crumpler. I was able to see that I don't stand here by myself. There are these individuals who came before, who opened the door and created the space for me to walk through. And with that, to understand that none of this is about me. It's about the service. And it's about what I do again with my life. So I go from Mount Sinai to Johns Hopkins, where I learned pediatrics and became a pediatrician. Now, I consider myself fairly bright. It had never occurred to me that I had any interest in education. Now, I tutored in high school, and then when I got to college, I tutored youth in prison. And then when I got to medical school, I created a class in microbiology for high school students, and I visited elementary schools in Manhattan. And then I got to Johns Hopkins in training, and I'm working with parent groups in public schools. It still not had occurred to me that I cared about education. Okay, all right. But I do that, and then I come back home to Boston and work in health centers. I'll tell you a little bit about that. But as I'm doing this, I'm saying I've learned how to do this wonderful work in medicine and in the hospital, and as I go to the community, what I was seeing was not people that needed ventilators. What I was seeing people that were really suffering from issues that are psychosocial, that existed in the community, had not felt prepared for that, and actually went back and did child psychiatry at Boston Children's. So I've left Hopkins, I'm in Boston, I'm working in a community health center, and I start working in the juvenile prisons. I become medical director in the juvenile prisons. I'd worked with them in college, and found I really love working with people who some people feel are troubled and a challenge, and I just think they're awesome. So I loved the kids in prison. I'm the person that sort of says, I love the 2-year-old that's saying no all the time. I love the kid in prison that's challenging me. I'm in a happy space with that. And I'm also working in many of the Boston public schools as a pediatrician. And it's during this time that I notice I'm in a community health center, and I'm in the public schools, and I'm in the prison. By then, I had also been appointed by the governor to this sort of mental health board for the city of Boston, and I'm seeing all of these parts of systems that are not connected, and I'm seeing people fall through the cracks, and I'm seeing resources being duplicated here and a gap in resources over there, and I'm seeing dysfunction. And I want to have a voice in this. And realizing that not a lot of people are listening or paying attention to me, and they're saying, don't just go in your corner over here, but I'm saying, but I have something I want to say. I have things that I think need to be changed. There are voices that are not at the table that are deciding about what happens to the lives of people that I care about, and those people who live those lives are not at the table. For me, it was this understanding that the disparity I saw, the injustice that I saw, the ism, the racism, the sexism, all of those things were not based on an individual or just an organization. They were really embedded within the system. So how could I be a part of changing that system? And with that came to Harvard. Now, when I was graduating from high school, I told you I only went to applied to one college, and that's where I went. It never occurred to me that I would be at Harvard. So I was surprised when I ended up there. But at Harvard, I started in a fellowship. It was an inaugural year of a fellowship with out of the president's office of the university around academic administration. And I wanted to know how it functioned. I wanted to know how the people that had resources made their decisions, set their policies, such that I could use that learning and teaching and take it back to the community that I cared about. And that's when I did this administrative fellowship. But as part of it, also wanted to know about population health. I did an MPH. In doing this, designed a program for Harvard Medical School, a proposal for how to advance diversity at Harvard Medical School. At the end, they asked me, would I take over the program? Would I run it? Would I launch it? And I said yes, and I'm thinking I'll do that for a year, and about 35 years later, that's what I do. That's what I still do. But this is a journey to find out who I am and what I'm supposed to be doing with my life. I get another degree from Harvard in policy because I wanted to understand population health, but I also want to understand how are policies made. And while doing this, I started a 501c3. It's an organization called Biomedical Science Careers Program, BSCP. It's over 30 years old now. More than 17,000 students have come through that organization. And so, but that's a lot, and it's good. But and it's an organization that takes no public funding. So when all this anti-affirmative action, all this other stuff was going on, it didn't have a big impact. And it doesn't screen out. Students screen themselves in. And it's open to everyone. But in doing this, I was working with corporate America, and they talked one language, and I talked another, and I wanted to understand, and that's when I got my MBA. As I did this, I was at Harvard Medical School. I became Dean for Diversity and Community Partnership. You heard that. I became a professor of medicine. I'm a pediatrician, but I'm a professor of medicine. Had not understood when I started this journey that today There's about 190,000 faculty in medical schools across the United States. There's only 400 black female full professors out of 190,000. Okay? So it hadn't occurred to me that I was a rare bird, right? It did occur to me that I needed to be in positions where I could create spaces for other rare birds, okay? Other paths for other individuals to move into this space, and that's what I do. My office runs about 20 different programs, and it runs programs from early career on. It also was a time for me to understand that I did not do this journey by myself. I started with family. I told you I always start with family. But there are all these amazing individuals who helped me along the way. Role models, mentors, guides, people that didn't sometimes even know that I was watching them to give me direction. And they were black and white and brown and male and female and scientists and physicians and people who had nothing to do with the space. Individuals who believed in me and helped me to fulfill my own dreams. So with this journey, it was starting to understand the gifts and talents I had been given, the knowledge that I had acquired from all these spaces, the skills that I had developed, my assets and strengths. So I don't begin in a space of what are my deficits and how do I improve those deficits. I have assets and strengths that I can build. It helped me to understand through this journey that others' false beliefs about who I am and what I can be are their problem. They are not mine. My interests expanded, my networks, those people and those connections became much larger. Relationships are so very important. My passion got defined better. I am an academician. I am into education. It is what I do. It took me forever to figure it out, but I finally did figure it out. And my choices are driven by those early values and values I told you about that came from my family. So I run the Office for Diversity, Inclusion, and Community Partnership. I am not about the pipeline. I actually don't even like the word pipeline. Pipeline is about they talk about a leaky pipeline and you enter this pipeline and then you fall through the pipes and you're lost. And people are not lost. We are not lost. We choose different directions. Sometimes we sort of get on a path and then we want to take another path or we stop off for a period of time. But we're on a life's journey. We're on a career journey. And I'm about how do I help people on that path to wherever they want to go? How do I help them connect from early to later in their careers? How do I put programs and things together that are consistent, that are not just based on one point in time, but understanding we need consistency of efforts in programming? How do I collaborate not just in the academy and in Harvard, but with my community, with my schools, with my community-based agencies? How do I do things in ways that they haven't been done before? How do I communicate across different sectors and across different generations and populations? How do I take into consideration that we all have multiple identities? Yes, I am black and I am a woman and I am a mother and I'm not black on Monday and a woman on Tuesday and a mother on Wednesday. I'm all of these things all the time. And how do we start to take that into consideration? All of us can be in the room. And how do we get commitment? Commitment from the top down and bottom up. And it's all in the spirit of care. How do we improve care for our patients, for their families, for their communities? It's a care about the institutions and the organizations in which I work and wanting them to be successful. It's a care about my profession and medicine and living up to the values that medicine professes that are around social justice and equity. It's a care for the populations that I am in. That's the work that I do. So programs that identify people from early on, from K-12 through college and medical school and graduate school and fellowships and early faculty. So if you look across all those programs that take people from those early stages into leaders and leaders from the local level to the state level to the national level who can create change. That's the gift I have been given, to be in a place to be able to do that. So why do I dance? I dance because of the life I've had, the family I have. That's me with my grandmother. I grew up watching my grandmother walk down these railroad tracks in the South, and we'd be coming from where she lives and going to the city. And we walked along the railroad tracks, and on one side of the railroad tracks it was paved, where all the white people lived, and on this side where my grandmother lived, it wasn't paved, it was crushed shells. And so this image of this tall, beautiful, strong black woman who cleaned houses and carried her Bible, that's what I walked down on that railroad track. That's why I dance. And I dance because of this other side. Here you see this is during COVID, and my grandson, I took him to this beach, there was no one there, and he discovered hermit crabs. Who knew someone could look at hermit crabs for 30 minutes? Okay, all right. But he was like, this is amazing, all right? The joy. The other one in the middle is I'm with my granddaughter in North Carolina, and we're walking through a parking lot. We'd just gotten her Lee press-on nails because she was, had to be. And she stops me, and I'm just walking through the parking lot, and she holds her hands up like this, and she says, Mama, I'm holding the sky. All right? The imagination. All right? The creativity of our youth. And then the one in the corner is that same granddaughter doing Black Lives Matter and saying, I want to be out there too. I want to march too. And me saying as a grandmother, but I want you to be safe. And she says, but I need to be there. So we were at the back, but we were present. My why is about this history, but my why is also about the future. So I ask all of you, what is it that you're chasing? Where are you headed? What is your vision of success? What is your why? You're going to have opportunities to transform the world around us, and you need to be informed by your own values. Your vision that the world can be better, it can change, and vigilance, staying the course. Understanding if you're not vigilant, we can slip back. Maintaining your voice, it's not okay to say it doesn't work or it's bad. We have to be heard, we have to change it, and strengthened by victories. And in the end, ask ourselves, what is our role? And for me, it's starting to say, I should, and ending with, we can together make a difference. I thank you.